Welcome back. November is Diabetes Awareness Month. It's a disease that affects millions of Americans, but many folks don't know exactly what the symptoms are or how it affects our bodies. 9 Health medical expert Dr. Payal Kohli joins us to talk about the disease. Good morning, Dr. Kohli.
Good morning.
So there are two types, type 1 and type 2. Can you explain the difference between the two?
Yeah, so the common pathway at the end is that your blood sugar ends up being high, but what causes that is different. So type 1 diabetes is autoimmune, where your body kind of attacks your insulin-making cells, so you're insulin deficient. Type 2 is where you have insulin, but it doesn't work as well, so you're insulin resistant. But the bottom line is that sugar goes up, damages our organs.
Wow. So the CDC says there are 34 million people with diabetes. 1 in 5 don't know that they have diabetes. So it's shocking. Why do you think that the discrepancy is there?
You know why, Natasha? Because a lot of times we don't know if we have high blood sugar. We may not have symptoms until it's very advanced. And if it is very advanced, then you have, urination frequently, thirst frequently, changes in your weight. But otherwise, early in the disease, it's asymptomatic. You don't even know that your sugar is going high and damaging your organs.
Right. So let's talk about awareness then. What are the symptoms and how do you know if you're pre-diabetic or diabetic?
So the best way to know is to check your blood test. And that's what's really important here, is that oftentimes it sneaks up on you. And until you go out and get a blood test, like the kind that 9 Health has, just a simple blood screening, you may not know that your sugar is starting to creep up, especially in type 2 diabetes. But when you get farther along in the disease, you can have headaches, you can have increased hunger, increased thirst, increased urination, a lot of pretty significant symptoms.
Let's talk about the screening guidelines. Has anything changed?
It has, in fact, and because so many Americans are now becoming pre-diabetic, largely because we're gaining a lot of weight and we're more sedentary, they have shifted when we start screening people. So basically, starting at the age of 35, if you're considered overweight, which is a lot of the country, then you need to get a hemoglobin A1C, which is that screening blood test to check for pre-diabetes or diabetes.
I've done stories on diabetes and people going through it, and recently did one on a type 1 diabetic, a young high school football player who was able to manage his symptoms and still play football and everything. And I found that there's always these preconceived notions. And can you talk a little bit about that, type 1 versus type 2?
Yeah, so type 1, because you're insulin dependent, that really requires insulin to control it. And it's a very challenging thing, especially when you're young. And we do see it in a lot of young people because it has a very strong genetic component. Type 2, on the other hand, I feel like is a lot more in our control.
Right.
You can
preventable?
In fact, reverse it even after it comes on by losing weight and getting off the couch and cutting down your sugar intake. And because a lot of it is associated with lifestyle. There is some genetic component to it as well, but a lot of it is lifestyle, our weight, our activity patterns. So that, I feel like, is a little bit easier for us to take charge of.
To manage and keep in check and just know our bodies too.
That's right.
All right. Dr. Kohli, thank you so much.